Hi, I'm Nicole Aaronson. I'm a pediatric otolaryngologist, also known as an ear, nose, and throat surgeon. Today I'm going to talk to you about nasal injuries, specifically nasal fractures. Nasal fractures are common because the nasal bones themselves are very thin and can't withstand a lot of force. Commonly in kids, nasal injuries are seen from sports injuries, although it can also be from trips or falls or motor vehicle collisions or other types of things. Common sports injuries occur in softball, baseball, wrestling, and competitive cheer, although they can also occur in basketball and other sports. When you're obsessing the nose, you can often tell where the injury came from based on the pattern of the nasal fracture. So a blow from the right might cause the right nasal bones to be infractured and the left nasal bones to be outfractured. Similarly, on the other side, and a blow from the front might cause a depression of the nasal bones. So when you're thinking about a nasal injury, you want to make sure that there's no septal hematoma. The septum is the cartilage in the middle of the nose, and it receives its nutrients from the skin flaps that overlie it. When you get a hematoma that separates those skin flaps from the cartilage can't receive its nutrients, and so it's important to clear that blood clot away so that the cartilage itself doesn't die. When there's no septal hematoma and you're thinking about a fracture, the best time to assess for a fracture is either within 4 hours of the injury or about 3 days after. After an injury, there tends to be a lot of swelling, and so if you don't catch it right away and you catch it a day later, it can be very difficult to assess just because of all that soft tissue bulk overlying the nasal bones. Families commonly wonder, should they get imaging for a nasal fracture? And this is generally unnecessary unless there's concern for wider injuries. So if I was concerned that the floor of the orbit or the maxilla or zygoma or mandible were also injured, I would think about getting a CT scan. But x-rays simply for nasal bone fractures tend to miss about half of fractures, so they tend to be unnecessary. So let's say there is a fracture, the question comes in, does it need to be fixed? And the two big categories that need to be fixed are people who have obstructed nasal breathing and people who have a significant cosmetic deformity. If neither of these are present, if the nasal bones are fractured and have remained pretty much in place and there's no significant deviation, then often these are just observed. If there is that cosmetic deformity or difficulty breathing and we're within the 2-week window after injury, we usually think about a closed reduction nasal fracture, which is a procedure where an instrument is placed in the nose, allowing the nasal bones to be repositioned back into alignment. It's a relatively short procedure, and depending on the patient age and comfort level, this can potentially be done in an emergency room setting or more likely in an operating room setting. Recovery from it is generally pretty easy. It's not as painful as the original injury. There doesn't tend to be the significant swelling that you see with the original injury. There can be a small bit of nose bleeding after, but usually that's very limited. So in summary, when we think about nasal injuries, you want to make sure there's no septal hematoma or any other facial injuries. If there is a nasal bone fracture, it's best assessed right at the time of injury or about 3 days later when swelling has gone down. If a significant cosmetic deformity or obstructed nasal breathing is present, closed reduction nasal fracture can be considered. If not, these are typically observed. Thank you so much for watching. If you want to see more of these kinds of videos, please subscribe to Dr. Nicole Knows.